Good afternoon, everyone. This is Winslow Woodland, Deputy Director for the Developmental Disabilities Administration. I will be standing in for Director Andrew Reese today. I would first like to welcome you to our weekly community and provider forum. We'll start off by sharing with you the data that we keep on COVID. So All right. I've been told that this view may be a little smaller than what you may be accustomed to, but if you can make the adjustments on your screen, that would be helpful to me because I've tried everything I know to do from a technology standpoint. I should note that this presentation will also be posted on our website. So for the month of February to date, we have 6 confirmed cases. That's up 4 cases from last week. And we should note that we have a total of 406 confirmed cases. We have 2 people who have tested positive again after testing negative. One was in April and one was in May. All right, in terms of placement type, as you can see, we have 192 cases that have been that are in supported living, and that is up 5 from I'm sorry, that's up 4 from last presentation. We have 7 in host home. We have 114 in ICFs. We have 48 in natural homes. We have 2 in nursing homes, 4 in out-of-state placements, and a total of 37 in residential habilitation settings. And in terms of percentage of infection rate and death by placement type, for intermediate care facilities, we have a total of 37% of the overall population, and we have had 10 deaths within the ICFs, and 10 of those have been confirmed COVID cases. For natural homes, we have an overall percentage of 5% positivity, and of those, we have a 10% death rate, and that is confirmed. All of those were confirmed COVID deaths. In residential habilitation settings, we have a positivity rate of just under 31%. We have a death rate of 8.8% with a confirmation of 5.8% of those. Supported living, we have a 20.6% positivity rate with a 7% death rate and 6.2% confirmed death rate. For overall percentages of all served, we have a 16.7% 16.7 overall percent positivity rate with a 11% death rate of those cases and 8.29%. I saw a comment in the slide. Could you read me that comment? It sort of was dealing with the numbers, and I didn't want to move forward past that.
So the comment is 192 in supported living is the same number Andy reported last week, but Winslow reported that there were 4 new cases since last report.
Okay, if I was not clear, the 4 new cases, 2 were in ResHab and 2 were in ICF. Thank you for that. Good catch. But the 4 new cases again are 2 were in ResHab and 2 were in ICF settings. And I should note that if you go back to the slide, one of the things you'll note here is if you look at the very bottom of the right pie chart, it says supported living. That number was the number that Director Reese had placed in that chart prior to the week of his presentation. So within the pie chart, you'll see 192, and that was the number for last week. But the 187 was a reminder of what the number was the following week. So hopefully that didn't confuse you more. All right, and just this little graphic shows you the spikes that we've had in the various placement types with the corresponding months. As you can see in December, latter part of November, December, and January, we had a significant uptick, and many people are correlating that to the holiday season and travel and visits conducted by staff and people served with their families. But thankfully, we have seen a significant drop, and we hope that it continues to stay steady. And in terms of those who've required inpatient treatment, I thought I had updated this slide that number should be 4 people who are currently hospitalized. And I don't want to do it now, but in the month of February, there are currently 4 people hospitalized. And there's a total of 140 who've required inpatient treatment. And in terms of those who've lost their lives, we have a death total of 46, with 33 of those being confirmed COVID, related to COVID to date. And this chart shows the confirmed COVID cases by month. And to date, we have 631 staff, provider staff who've tested positive for COVID. 47 of these staff have worked for more than one provider, and 10 of those, unfortunately, have lost their lives to COVID. So that is our data. We can move into our round of questioning. In 1 second, I just wanted to share with the group that this week we had a presentation for our provider nurses that was conducted by DC Health epidemiology specialist nurse Daryl Hawkins, who I believe there were 300 in attendance for that particular presentation. And we're very pleased to continue to be able to provide these type of opportunities to our provider community and staff to continue to try to mitigate the virus. This presentation was specifically on the quarantine and isolation process, and I believe we will be placing that training online for those who were not able to attend. So we also have I see another question. Okay, it says, Winslow, still confusing since the total last week was 398. Today's total is 406. That's an increase of 8. Actually, today's total is 404, and 2 of those are repeats. So when you see 400 last week, keep in mind that 2 of those people, I'm sorry, no, last week there were 400 positive cases, and then 2 of those people reported, which the number would have been 402 total, but 2 of those cases were repeats, and we've had a total of 4 new cases since last week. So 406 may seem confusing because it just counts 2 people twice. And I'm sorry for all of that confusion if there is any. So what was that? Where was that? There is still continued work on our Appendix K that we will be submitting to CMS. We've been working with DHCF on that, and the primary changes that we're looking to get approved is the use of remote supports with the person being able to be supported by another provider while they're receiving that. And we're also looking to get permission for people who are able to provide companion to enhance who can provide companion. We also are working to have another vaccine clinic, which will, I think the tentative dates are the 23rd and the 24th of February. And this will be open to all of those who are able to receive the vaccine based on the guidance that comes from DC Health. And okay, I see Robin Shafford has typed that last week it was 398 and 404 this week is 6 people more. I will verify that. You could be right. I'm not a statistician by trade, and I hate when I don't get numbers right because some people live by exactness. I can tell you that I do know that there are 404 people who are positive to date. And I didn't present last week, and I probably wasn't paying as close of attention as I should. But at any rate, I'm so glad that all of you are paying such great attention. It really makes me feel that everyone has their head in the game when it comes to this COVID. So we'll take questions. I believe we had one question that was submitted prior to the onset of the call.
Good afternoon, everyone. Could DC Health please provide clarity around CDC guidance regarding quarantine recommendations for fully vaccinated persons? Based on my reading, the updated guidance quarantine recommendations still stand for our settings, including healthcare professionals, but is there anything else we need to be aware of?
Great, thanks. That's a great question. CDC did release an update on February 10th, so just a few days ago, but I will remind everyone on the call that DC Health is reviewing the updated CDC guidance, and we review CDC guidance in addition to the national and local DC data and the most current scientific evidence whenever we make any changes or revisions to the DC Health guidance, which applies to DC healthcare facilities, DC residents, DC healthcare personnel who work in DC. So at this time, DC Health guidance for quarantine, infection control prevention, COVID-19 measures continues to remain the same for both vaccinated and unvaccinated individuals. So I'm going to echo what Winslow says. It's so great to hear people who are so, keeping track of the changes from CDC. It tells me that you're really trying to stay on the most current information and using the right sources. I will remind everyone, though, that DC residents, DC healthcare facilities, DC healthcare personnel that work in DC healthcare facilities should continue to follow the DC health guidance, which is posted on coronavirus.dc.gov. Because we really look at the CDC guidance in addition to our local data to make those guidances for our DC community. So right now, nothing has changed on our end, but we are reviewing it. And when it does, we will certainly let everyone on this call know. And I hope that answers the question. Thanks.
Yeah, and thank you for that, Daryl. And the comment regarding the number 398, that is exactly accurate. And I apologize for the error. It's my job to send this data out every day. And as I look at my Monday report, there were 400 people who were reported, and then 4 more came in after that. So what I'm going to do is make sure that I correct that before that slide is posted. And I can take any other questions that while I look at this data.
There are a couple of people who have lost their personal ID. Will they accept a birth certificate or Medicaid card to permit them to get the vaccine?
That question I will defer to my esteemed colleagues at DC Health.
Hi, everybody. It's Karen Stringfield. Winslow, I assumed that you were talking to me when you said colleagues at DC Health.
Oh, I'm sorry. I should be more specific. We have the expert in epidemiology, and then we have the nurse that's working to coordinate the vaccine effort. For those who don't know, Nurse Stringfield sits with Dr. Shaw, who's leading the vaccine effort for the city. She works very closely with Dr. Shaw, and will heretofore refer to her as the vaccine expert. And
oh my goodness, no, that's a lot of pressure.
Well, pressure makes diamonds. So.
So only if you start off as cold.
Okay.
So as far as the identification, I don't have a good answer for you, as I don't want to give you wrong information. That's something that I will have to ask. It may be pharmacy specific, but again, I'll follow up with that and then relay that information to you, Winslow, and then you can disperse it as needed.
Thank you so much. Make a note of that to get back with you on that. Next question.
Deputy Kirk Dobson sent a note that he will release more information regarding the second dose appointment next week. And last week there was mention that the requirement to get 2 negative tests before returning to certain services is old guidance. Can you tell us what the new guidance is? So I guess Kirk will
Yes.
share more information.
I'll let our epidemiology nurse consultant answer that question.
Thank you, Winslow. Great question. So DC Health guidance on discontinuation of transmission-based precautions for individuals who are positive for COVID-19 and our DC Health guidance for return to work for healthcare personnel who are positive for COVID-19 both state that DC Health no longer recommends the requirement of 2 negative tests prior to clearing individuals who are under isolation or, in other words, infected from either returning to work or being off of transmission-based precautions. And the reason for that is that CDC also updated their guidance on this, is that there are individuals who are no longer infectious that may continue to test positive on their on the PCR test, not because they are still infectious, but because that PCR test may be picking up viral pieces that is not infectious virus for those individuals, therefore unnecessarily prolonging their isolation period when they are no longer at risk of transmitting it to others. So our guidance instead states if somebody has symptoms that you use the symptom-based strategy, which is again outlined in our guidance, or if they've never had symptoms to use time-based strategy, which is also outlined in our guidance. And I will post those 2 links on the chat for people's reference. And that's also found on the coronavirus.dc.gov under the tab health guidance for those that want to take a look at that. Thanks.
Thank you.
Okay, and I'm not sure if we have data regarding this next question. Can you please provide an update on the progress vaccinating people in ICFs and residential HAB settings? What percentage of those people have received their first vaccine, and is there a plan in place for them to receive second shots?
All right, so I will repeat, we are working on a second vaccine clinic, and that vaccine clinic will focus specifically on those people who need a second shot. And in terms of numbers, I would have to defer to, and I don't know if Deputy Dobson has those numbers handy, but I don't want to misspeak on that, but I can see if, because I know Karen worked closely with Deputy Dobson on those numbers. And I believe there were just under 200 people, but don't quote me on that answer, and we'll get you that number. And I will just like to add, just for context, this is not mandatory, and there are people opting not to take the vaccine, although we're strongly encouraging people to take the vaccine, and we're doing everything in our power in terms of coordination. 2 weeks ago, I think DC was listed at 5th best in the nation in terms of distributing the vaccine to its citizenry. And while I've heard people have grave concern about how we're a consumer-driven society, and I think that leads us to believe that whenever we want something, we should be able to have it. But this is not your ordinary distribution of a consumer good. This is a on the ground effort. And as was mentioned last week, the district can only distribute vaccine that's actually been delivered. And there are cases when vaccine is delivered that people are not using the vaccine distributed amount that day. And I've heard that some people, just by being at a store, are able to get the vaccine because they don't want to waste it. So I ask you to consider, when this vaccine is distributed, no one wants it wasted. And so we have to plan effectively. And I believe we're doing the best that we can to ensure that our people supported are in line for the vaccine. We've been working on this before vaccine even hit the district. Do you have any numbers, Karen, off the top of your head?
I believe that the total number of people that were vaccinated January 26th and 27th at Kenilworth was about 320 people.
Okay.
I don't know what that is in terms of percentage of your total ICF and CRF population.
That would be if that number 320 is the actual number, we have just under 400 people in res habs and ICFs. I think the number is 273 for ICFs and 105 for residential habilitation. So that would be pretty good percentage wise. But I should also add, for the benefit of this conversation, that there are many people who are receiving these vaccines at federally qualified standing clinics, and others who are 65 and over who have made preparations to receive the vaccine on their own. And DDA, we have more control over the ICFs and the supported living and rest habs because we have providers who serve as informants on information such as who gets vaccinated and who doesn't. But natural homes, there's no requirement for people to share their health information with us. It's optimal when they do, but we can't say with certainty how many people have had the vaccine to date. But because of that clinic and our coordinating it, I trust that number 320 because, as I said, Nurse Stringfield was on the ground, and her and Deputy Dobson worked feverishly to put together the scheduling system to encourage providers to take advantage of this wonderful opportunity, and are working to plan this second vaccine. People are calling in the clinic. Hawaii calls it a hub. I was on a national call with some states regarding the vaccine distribution with regard to their being able to coordinate it. And I think that there are many who are struggling, and by many, I mean states who are having a hard time figuring out how to get this vaccine out.
And for those who are looking for an exact number, Deputy Dobson sent me a note that he can report out on the exact number next week on Wednesday. Are we required to have a person served tested for COVID prior to receiving the vaccine? This is for people who have shown no signs or symptoms.
I'll defer to DC Health, but off the top of my head, I have never heard of a requirement that you be tested prior to having the vaccine, but I'll defer to the expert.
Go ahead, Karen.
Oh, I haven't heard of such requirement either, so I would say no.
I concur. I would say, as we have recommended, test individuals for COVID-19 for the same reasons that we were asking you to test them before. One is if they show symptoms. Two, if they've had a direct exposure. That's other times that you could consider it. But otherwise, there is no requirement to test individuals without an indication prior to vaccination. Thanks.
And are there plans to set up additional appointments for the first dose? We have not been successful in securing appointments for the first dose for most of the people we support in ICFs. And Deputy Dobson reported that he's working on new appointments for the first dose, and more information will be released next week. So stay tuned, everyone. In regards to the 320 staff or people supported, I believe we will report out next week. Is that correct? Winslow?
Yeah, well, yeah, I'll ensure that I get that number from Deputy Dobson. But I am a bit discouraged that people are still having trouble getting these appointments. And we have a standing meeting Monday with DC Health, and we'll definitely make that an agenda item. We talk about it every week, but my hope is that as we're further along in this process, that we will be getting more vaccine. I've been reading reports that we will be getting more vaccine, and hopefully what that means is we'll be able to get more appointments freed up. Because I do know a couple of people 65 and older who literally had appointments online, and then they were told that the appointments were canceled because, you know, there wasn't enough vaccine to go around. I've also heard accounts of people receiving the vaccine, and this is not DDA target population and or staff, but I've heard of people who've been able to get the vaccine, as I've stated, just by being in a store at the time of the day that the store may stop distributing the vaccine, and rather than waste it, they just ask if people want it. I've also heard the horrid tales of people misrepresenting themselves as people who are already able to get the vaccine. So we'll keep working. We definitely want our folks supported to be in the front of the line as much as they can be. Interestingly, we had a discussion, and it was sort of interesting because there was a time when certain clinics and hospitals required days for our target population to come, and people fought vehemently in terms of that not being fair or representative of an integrated kind of society culture. And now we find ourselves wanting to be set aside and apart for a purpose. And I just thought that was very interesting. But in this case, I'm willing to take that.
Has any headway been made in discussions between DDS and DC Health in moving people supported by DDA who are under 65 and not in ICFs or rehab for the priority list for vaccinations?
I'm sorry, could you read the first part of that question again?
Yes, any discussions between DDS and DC Health and moving people supported by DDA under 65, not in ICFs, not in ResHabs, up the priority list for vaccines?
Yeah, we have that discussion every week. So the thing that I can tell you is, none of us on this call makes that rule. And we have to follow it. And believe me, when I tell you, we're trying to do the best that we can with regard to ensuring all people have an opportunity to get this vaccine. And we are aware that some people have tried and have not been successful, but we talk about this weekly. And as vaccines is available and we're able to get it to people who don't fall into those categories, believe me, we're going to get it to them.
When an employee is vaccinated, will they still need to test for COVID?
I'm going to defer that question to Daryl because I think she sort of already answered that, but I'm just going to defer it to Daryl.
Could you repeat the question?
Sure. When an employee is vaccinated, will they still need to be tested for COVID?
Yes. So if, regardless of vaccination status, if an individual, whether it's staff or person supported, has symptoms indicative of COVID-19, we would suggest tests or any other reasons that we currently are asking people to get tested, including maybe a direct exposure to another individual that is positive for COVID. So regardless of vaccination status, the testing guidance continues for individuals, both staff and person supported.
Thank you, Daryl.
And there's a suggestion, our main pharmacy that we use to provide medications to residential persons are in the process of acquiring vaccines and will be able to provide them to persons and employees under our agency.
Could they share
Which pharmacy?
Yeah, because it's my understanding that there were several additional pharmacies brought online to be able to help with this vaccine effort, to include Harris Teeter and is it Walgreens? There were the government's entered into agreements with other pharmacies so that we can expand who's able to distribute the vaccine, which is positive news.
Okay, so Alpha Pharmacy.
Okay, that's a new one. I haven't heard of them, but that's good to know.
Any idea of when that will happen? It just says are in the process. So I don't know if you have a time frame for that, the person who shared that information.
It said not at the moment. I would suspect that would be information that would be readily available to the public as it comes out. It's good to know that this is encouraging. But I've heard of at least Harris Teeter and I believe it's Walgreens being added. We may actually go and that just triggered a thought in my mind for no particular reason at all, but there has been reports of people claiming to have the vaccine and trying to defraud people in terms of charging prices for it. So I would encourage any and all on this call to ensure that they look out for that. There's also this public health emergency has also lent itself to all kinds of opportunities for people seeking money. And I think maybe one of these calls we'll have our colleagues from the Office of the Inspector General possibly share some data on what they're seeing in terms of people calling people's homes and misrepresenting. And that just jumped in my head because I'd heard about people trying to sell vaccine that wasn't actually vaccine.
And a question regarding our Appendix K, when will that be finalized?
We're pretty near close to submitting. I was in a couple of meetings this morning, and I think that, we can provide you a more solid update next week. We do know it's in the hands of our partners at DC Healthcare Finance, and making sure that all of the recommendations that we want actually fit within the guidelines of what we believe CMS will accept. I know for some it seems like a very tedious process, but we really have to be thoughtful in what we present to CMS, because their time is valuable and so is ours. And what we'd like to do is to look at some of our neighboring partners in other states who have been able to be creative, and we kind of tweak what they have, and then submit what we have. So it should be very soon. I'll just say that. And I will also just like to say that DDS is having its performance hearing, and that will be on the 18th, which is next Thursday, and I believe it's in the morning at 9. Someone can correct me if I'm wrong. I saw one question. I haven't been able to get my screen to share the way I wanted to, but I mean, to display as the one, and it has to do with, I don't know if you can read that question regarding people testing positive for the virus related to the vaccine.
Let's see. Can you clarify if people who have tested positive for COVID have any waiting period
Oh, here.
for getting a vaccine?
Hi, it's Karen. I think I need more information on the question. Are we talking about people who are actively positive or have tested positive prior, have gone through the isolation period, and are now COVID free? And I guess that I'll answer it either way. For positive people, stay in your isolation. And then for people who had previously tested positive and are now COVID free, I would say defer to whatever your primary care provider is saying. There is I guess the thought that, and the the studies that your immune system and the antibodies will last in your body for about 90 days. So if we are looking at a critical shortage of vaccine, then yeah, sure, wait that 90 days. But if you discuss it with your doctor and they say that you can get it within that 90 days that you have been declared COVID free, then go ahead and get it.
Someone has asked for the reminder of the number to call for vaccine appointments.
I put in the chat box. The number is area code 855-363-0333. And just as a reminder, when you call that number, it doesn't have access to any other vaccination appointments. They're going to be using the same portal that is at vaccinate.dc.gov. So my recommendation would be to go to the website first, unless you're absolutely unable, because it's a quicker process when you do it through the internet. But if you can't, go ahead and call.
I also see that there's a comment that CVS staff are visiting group homes in Montgomery County to vaccinate staff and residents. And I would say that is really incredible. I'm not aware of that occurring within the District of Columbia. And if DC Health is able to ever have that available to us, that would be great.
So Winslow, what I will say is that CVS and Walgreens are part of our federal partnership. So they have been deployed to nursing homes and assisted livings in DC. We are working with two independent pharmacy, Ramdas Pharmacy and also Flex Care, to provide some on-site vaccinations. That is a long process, and if you can imagine, there are numerous, like over several hundred group homes and congregate settings in DC. So it does take some time to kind of organize those things. So that is also an option, in addition to, as you stated, the increase in vaccines that we're going to be getting from the federal government. So there will be a little bit of, I guess, reprieve from the gridlock vaccination appointments. So I can't say when, but it will be looking up in the next couple of weeks. I'll say that.
Thank you for that. And by looking up, I'm sure everyone knows what that means, but I just will try to clarify, because sometimes I use terms and I like, we will get there, people, is what Karen just said. And that we can be positive. Anyone see what else do we have?
Can there be a forum to train on the process for CPR on COVID-19 positive patients?
Oh, interesting. So if I understand, the question is, because if a known person has COVID, there's some concern that that person's CPR would have to be administered in a different or a more considerate fashion based on the COVID diagnosis. That's very interesting. I'd like to hear your take on that, Daryl.
Yeah, so actually, the American Heart Association released interim guidance on cardiopulmonary resuscitation during COVID, because CPR is considered a potentially aerosol generating procedure. And sometimes we don't know that somebody is positive for COVID when we're responding to somebody who needs CPR. So there is guidance to that. I'm happy to post that from the AHA, American Heart Association, in the chat. But and it does go over both bystander and out of hospital type setting guidance, and also in the hospital as well, which doesn't necessarily apply to the setting for those on the call. But I can post that in the chat. But there are some considerations. For example, hands-only CPR when responding out in the community is one of the things that they do have in this guidance. So I'll post that for their reference. In terms of a webinar, I'll defer to DTS on that.
Thank you.
So someone posted a note. I'm not sure if it was an email or a note. Dear community partners, I'm writing to advise the community that Westlink Career Institute has been awarded a federal grant to make the community aware of hands-only CPR and make the right 911 call. Westlink, along with DC Fire and EMS, offers this free training to DC, Maryland, and Virginia residents. Please let your clients and customers know of this free class sponsored by Westlink Career Institute. And you can register by email, dcwestlink@live.com, or on the website at www.westlinkdc.com.
And I don't know for certain, but I would have to say that DDS is not endorsing or advertising for Westlink. I just think we need to say that, but we really appreciate all of the resources that people are submitting to share, and that's what community does. And we thank you, whoever posted that.
The Committee on Human Services will hold our DDS's performance oversight hearing on February 18th at 12.
So thank you, Crystal. Is that a repeat question? I'm sorry, I wasn't clear. When I said soon, I'd see that it says, when will the amended Appendix K be finalized? As I stated, it is now in the hands of our partners at DC Healthcare Finance, who may not be on this call. But typically what happens is we meet, we add additional requests, we review, we make sure it's sufficient, what we believe is sufficient to submit to CMS, and then it would be in their hands. And to my knowledge, as of this week, it's not left DC Healthcare Finance. Is there any way to unmute Ms. Parker if she's on the line? Take that as a no.
What you stated is correct, Winslow. We are waiting for, right now we're looking at adding supplemental payment information into our Appendix K. So let's see, I think we've moved Ms. Parker over.
Good afternoon, everyone.
Yes.
I'm just going to reiterate what Winslow and Crystal have shared so far. Everything on DDS's side has been finalized, so it is currently with DHEF. There are still some calculations that are being made on DHEF's behalf. Once those calculations have been made, then they will proceed with submission to CMS. This is as of yesterday when I spoke to DHCF staff.
I'd also just like to share, as we get ready to wrap up, the fact that our director and several other staff had conducted another round of visits to our provider community placements, and it was reported that providers are now showing tremendous improvement in screening, are showing promise with mitigation in terms of ensuring that their staff are aware of all of the current mitigation strategies. And what I just like for people to know is that, you know, our staff are frontline workers who, in many cases, may not have the training of a clinician. And our clinicians within our provider community work feverishly to explain and to ensure that the staff is able to actually practice solid mitigation strategies. And for those of you who've really been on board with this effort from the beginning, we're coming up on close to a year of having taken our provider system, and our wonderful providers have made tremendous adjustments with regard to how they do business. Our service coordination staff, our health and wellness staff, quality staff, all of the various units of DDS have had to monitor and continue ensuring that services are in place. Our partnerships with DHCF and DC Health and the Department of Behavioral Health have just been ramped up. We always had relationships and we always met, but we're in this fight together. And for the families that are I've talked to many family members since this has been going on, and you know, the disruption to the routine for their family member who we support, you know, they're doing a tremendous job in making sure that they keep their people active. We also are going to be working with the Special Olympics on a resource that should be shared freely and openly, where it's a remote opportunity for people to engage physically, because what we recognize is people need to continue to move and stay healthy, even though you know, they may have limited access to their communities. And the beauty of this expert group offering those recommendations is they understand some of the consequences of people moving when they may have challenges in interfacing with their environments and things. So, you know, let's all stay positive. Let's all continue practicing solid mitigation strategies. And, you know, for the snafu on the numbers, you know, I was off a little bit, and I promise you next week I'll have those numbers scrubbed. But the number of people who've tested positive is 404, and it is up 6 from last week. And I will definitely make sure that I have those numbers accurate next week. And to all of you, stay safe, stay positive, and we'll get through this. And see you next week.